What's up, everyone? Happy
Hello.
Wednesday.
We are so glad you guys are joining us for our kickoff and our live event. We are so excited about our dose calculation workbook and so excited to share a number of things with you today.
So many
So,
things.
I know we have three big surprises that you definitely don't want to miss. So, definitely stay throughout the live event because you're definitely going to want to hear these surprises.
Yeah, they're going to be amazing. And I'm very excited. This is our first ever live product launch. So, really, really stoked to get to share this with you guys, tell you about how much we love this product, how much of our hearts and souls we put into it, and all of the cool things that are inside. We're so excited. I'm so happy you guys are all here.
Totally. So we're gonna do a number of things. We're gonna kick things off though by first recognizing our members of our YouTube membership. We have a number of members who have been with us for 1 month, 2 months, and 3 months. So Maris is going to list out their names. We are so grateful and so happy to have you as part of our membership. And for anybody else out there who is interested in joining, we have a number of awesome perks for our members. So definitely check that out.
For sure. So these are our tier 2 and tier 3 members. So celebrating 1 month, we have Aishina Allen, Helen Hurst, Lydia Kai, Chica Sophia, Ruby Prado, Kay Johnson, Amanda Colton, Holly Sink, Maddie Patton, Kyla Vita, Renara Joseph, Jada Hanneman, Ash, Ann Sinowick, and then Nis14 and Very, Very Vorch. Thank you for being with us for 1 whole month. We appreciate you so much. And celebrating
Awesome.
2 months, we have Elizabeth Merlino, Faith, Serena Feast, Char Archangel, Chelsea Williams. Thank you so much for 2 months of hanging out with us on YouTube membership. And
Yay.
celebrating 3 months with us, we have Katrina Baskin, Chelsea Walker, and Doris Ng. Thank you so very much. We are just thrilled to have you, and we have so much awesome stuff coming the way of our YouTube members. And if you want to join, please absolutely check it out. We have a bunch of different tiers with different rewards, and we have amazing stuff heading your way. You have no idea.
That is awesome. Thank you again, guys. Thank you so much for your support. So, what we have available now is our dose calculation workbook. I've got little sticky notes in mine because during this live broadcast, I will be working through a few of the examples in this book. But before we do that, Maris and I want to share what makes this book so special. So this has been a long time in the making. We made this the book that we wish we had when we were in nursing school. It is super comprehensive. So really it goes from very basic conversions between like within the metric system, within the household system, between the metric and household system. And we go through many other topics all the way to like critical care topics, including heparin titration, insulin titration, the Parkland formula, and more.
Yeah.
This book is hard copy, so it's not like the paperback book that I had
Nice
in
and
nursing school.
durable, but it also
Totally.
lays flat, so it's not
Totally.
annoying. There's nothing to contend with. You can put it flat on your desk and work through it. You can bend it over if you're like me and you want to flip through that way. Very, very durable, very flexible. We did this on purpose. Everything that we design is with intention, and this was specifically so that you can throw it in your backpack. It won't get beat up. It can take a beating, and it's something hard to write on too if you're like on the go. So for sure we did that on purpose. Like Kathy said, this covers you from day one all the way through the end of the program. So our goal for you is that you can buy this the one time, day one of nursing school or any other time that you are in nursing school, and use it for the duration of the program, so that you can have it the whole time to help you. And even if you went through this whole book, you still can go back through it, and we have example problems, practice problems, and some other really, really great stuff in here too.
Totally. And this book features 3 different ways of solving the problem. So some people like dimensional analysis. Like I like
People like
dimensional
Kathy.
analysis. Yeah, I love dimensional analysis, but I also understand and appreciate that other people prefer other methods. So Maris, yes, Maris likes ratio and proportion.
I am a
And there's
ratio and proportion girl until I die. I've done dimensional analysis. It just doesn't work for my brain. And we know that the way everybody's brain works is differently. And you shouldn't have to force yourself to understand how to do math one certain way. You should do it the way that makes sense to you.
Right. And we've also included the formula method, which is a great straightforward method to use for many dose calculation problems. Not every dose calculation problem, but where it can be used, we have demonstrated it being used throughout this book. And
Yes.
the beautiful thing about this book is we have color coded the
So here, I've got it up
different
for you.
methods. Oh, you got it
Yeah.
up. Okay, good.
Yeah, so dimensional analysis is always first and it's always blue. Ratio and proportion comes next, and that is going to be the green one. And then you have the formula method here, which is purple. And we did that so that you can say, I'm ratio and proportion, I'm looking for green. Or I know that I am all in with Kathy on dimensional analysis, I'm looking for blue. Then you can ignore all the other color stuff and just look for your color and you know what you're looking for.
Right. So you could just skip to the color you know you like best once you figure out the method you like best, and just really focus on that. We have worked out many, many example problems in all 11 chapters of the book. And then for each section, we have a number of practice problems that you can work out right in the workbook. So the workbook gives you space to work out those problems. So you can do it right there with your pencil and your calculator and put your answers right in the book.
Sprite Clan, really quickly. First of all, Sprite Clan represent. But second of all, yes, we absolutely included OB. So we have a whole chapter on maternity math just for you.
Totally. And yeah, there's a huge pediatric section that includes strength of feeds, maintenance fluids, calculating fluid balance. We have a whole maternity section.
Safe dose range.
Yep. Yeah, safe dosage ranges. In the ped section, we have IV infusion calculations using a pump, using gravity, using weight-based IV calculations. So really just about any type of calculation that may be thrown your way in nursing school, we have you covered. And kind of sprinkled throughout this book, Maris, you want to show them our little...
Okay, so you guys know we want to be, here for you with the facts, with the information. We want to give you credible, peer-reviewed academic resources to use, but we also want you to know that we got your back always and that we are in your corner. And so sprinkled throughout, we have little pep talks in here. And these are all pep talks that were handwritten by the nurse team, just because we know that this is a little bit of a slog. It's, med math is not like the most fun thing in the entire world. But we want to remind you that we are in your corner and we have your back and we want to see you succeed. So we have a bunch of unique and different pep talks sprinkled throughout the book so that when you are getting frustrated and burned out, there'll be a little pep talk from us and you can be like, oh, Maris and Kathy have my back. Because of course we do.
Absolutely. And on the inside cover and the back cover, we have all of those key conversions that you definitely have to memorize and know. So you can easily go there to look at how many milliliters are in a teaspoon or in a tablespoon, how to convert from, Celsius to Fahrenheit, standard to military time. We have like every type of conversion that you will need in this book. So Those are readily accessible inside either cover. So
yes. So I was going to say, there was a question here. Is there an online book? And that's a great question.
Yes. So there is an online companion that comes with the book. And this online companion, we put a lot of time and heart into that. And basically with that companion, I work through every example problem in this book on my whiteboard. And I work it through all three ways. So I do it with dimensional analysis, I do it with ratio and proportion, and I do it with the formula method. So for every example problem, you'll see it worked out in the book, but then you can also log into the online companion and watch me watch me go through it and explain why I set things up the way I did and how to go about solving these problems. So
Yes.
we know that people aren't just, everybody learns differently. And some people can read a book and be like, got it, good to go. But a lot of people are visual, auditory learners, and myself included. And so I always like to see stuff being worked out. So in the online companion, I've worked it all out.
And on top of that, not only do we have Kathy working out all of the example problems, in the book, every chapter has the complete answer key where we give you the answer to every single problem. But if you are working it out and you're like, I just don't understand how you guys got to this answer, I keep getting 3 and you're telling me it's 52, then go to the online companion, because we have a detailed answer key for you there where we work through every single practice problem with the math. So we show you step by step in all 3 ways how to get to that answer, so that if you're sitting there going, I swear you guys have this answer is wrong, I know that I'm right, we'll show you how we got to that answer.
Totally. And one thing I wanted to point out that I forgot to talk about is throughout the book, we have some drug labels, because often with your dose calculation exams, you'll be given a copy of the drug label and you'll need to read that to figure out the available drug concentration or the reconstitution instructions. So we want to give you practice doing that as well. So throughout this book, we have a number of drug labels that are incorporated into the practice problems and example problems.
Yeah, because you can be really familiar with MedMath and you can be like really comfortable with how to work through these problems, but it hits different when you're on the floor and you are literally looking at a drug label and you've got to figure out, how much do I reconstitute with, and how much am I pulling out of this? You've got to be familiar with what actual drug labels look like. So we tried to put those in here as well so you can get comfortable with that.
Totally.
Can you please explain what the online companion is? Yes, so the book is the book. This is the hard copy book with all of the information you need, all of the practice problems, all of the example problems, all of the good stuff. The online companion course comes with it, and what it is videos of Kathy working out the example problems, and you can click through. So you can say, I'm looking for example 2 from chapter 6, and you can just click right there if you want to. And then it also has the like detailed answer key where we work through every single problem step by step. So it is not a replacement for the book, it is a companion to it. And so when you purchase it, you will be granted access to that online companion.
But this also stands alone. Like, you could just read this, work through the problems here. The answer key is in the back of every chapter. Yeah. This is kind of an additional resource to have, be able to watch me kind of working through the problems, real time. Right. So, but you could totally take this with no internet access and just learn and work out of this book as well.
100%. Yeah, for sure. Because we know that like you're gonna need this for, take it in your backpack, take it on vacation, do whatever you're doing. This is complete on its own, but this is just supplemental stuff to help you if you need that extra little assistance.
All right, should we lay down our first big surprise of the evening?
I think so.
For everybody here on our live event, our live kickoff, we have a super special promotion if you get the dose calculation workbook. So if you use the code LIVE35, you will get 35% off our dose calculation workbook. There are limited quantities with this code, so you definitely don't want to delay in doing that. And it is only good until midnight tonight, Pacific Standard Time. So that is a big deal. This is a huge discount. So it's over a third off the dosage calculation workbook. So if you're interested in getting it, make sure you use this coupon code when you order to get that discount.
Yep. And I just put it in the comments too. So if you're watching this and you're like, what is it? It's right there in that comment for you. Live35. It'll save you 35% off the already discounted Dose Calc workbook. So you can save a whole bunch on it.
Totally. So I'm actually going to write it up here. Can we see that up there?
Not,
Nope,
not
it's
well.
too low. All right, I'm gonna write it a little lower, but I wanted to try to free up room because the next thing I'm gonna do is work through some problems. So live, oh man, let me write a little bigger here. It's in the chat too. You could just put it in the chat, didn't you, Maris? Live 35. All right, now everybody can see it, right? So definitely use that code when you order the book. Okay, so we did a poll yesterday and today to see what types of problems you wanted to see me work through during our live event today. And the two types of problems that I'm going to work through that got the most votes, the first was calculating the IV fluids that a patient receives when they are getting a continuous IV infusion as well as a piggyback medication infusion. So as you guys may know, if a patient is getting a continuous infusion of like normal saline or lactated ringers, they are getting it around the clock, 24 hours a day. But if they have a piggyback medication, such as an antibiotic, when that piggyback medication is running, they are not getting their continuous infusion. So you have to really account for that when you are calculating the amount of fluids they're getting over a 24-hour period. So let me get my book here and bring up my first example. And Maris, you can stop me if anyone has any questions or if I'm going too fast or anything. Okay, so in this first example, our patient is getting lactated ringers at 100 milliliters per hour. Okay, that is their continuous infusion. In addition, they are getting metronidazole, which is an antibiotic. They are getting it every 6 hours, and that metronidazole comes in 100 milliliters. So they're getting 100 milliliters every 6 hours. And our question is, how much IV fluids are they getting within a 24-hour period? So they have their lactated ringers running at 100 milliliters per hour. And then they're getting their metronidazole, which is in 100 milliliters, and they're getting that every 6 hours. All right, so lactated ringers is going to be running except when they're getting their antibiotic. So how much time is a lactated ringers running within a 24-hour period? In order to determine that, we need to figure out how long the metronidazole is going to be running within a 24-hour period. So metronidazole comes in 100 milliliters. It's given every 6 hours, and it runs for, sorry, I forgot to give you one last piece of information with this problem. It runs for 30 minutes each time we give it. So if we're giving it every 6 hours, that means we are giving it 4 times in a 24-hour period. So 24 divided by 6 is 4. So we're going to be giving it 4 times. And each time we give it, it's going to run over 30 minutes. So over a 24-hour period, we're going to be giving metronidazole for 2 hours. Okay, so 30 minutes each time times 4 times in a 24-hour period equals a total of 2 hours. That's the amount of time we're going to have metronidazole running. So the lactated ringers is going to run the rest of the time. So lactated ringers is going to be running 22 hours out of the day, right? So metronidazole is going to be running 2 hours in a 24-hour period, and lactated ringers is going to be running 22 hours in a 24-hour period. So now we can calculate first how much lactated ringers they're going to be getting within that time. So over 22 hours, they are getting lactated ringers at a rate of 100 milliliters per hour, right? That is the rate. So here my hours will cross off. And if I do this math, I end up with 2,200 milliliters. So that's how much lactated ringers they're getting within the 24-hour period because it's running for 22 hours and it's running at a rate of 100 milliliters per hour. Now we need to figure out how much fluid they're getting from the metronidazole. Like I shared with you here, metronidazole comes in a bag that's 100 milliliters. That's the amount. And they're getting it 4 times a day because they're getting it every 6 hours. So if I take 100 milliliters times 4 times a day, that equals 400 milliliters. So that is the volume of fluid they're getting from their metronidazole. So if I add these two together, 2200 plus 400, that equals 2,600 milliliters of fluid that they're going to get from their lactated ringers, their continuous infusion, and their metronidazole. So that's going to be the answer as far as the total volume of fluid that they will get in 24 hours. So does that make sense? Does anyone have questions?
And this is super duper important too, because I think a lot of nursing students and perhaps even nurses don't recognize that most of the time, and because the reason I say most of the time is because there are pumps that will allow you to run primary and secondary concurrently. But most of the time, when you have a secondary, a piggyback, your primary is not running. And so that's really important to understand, because if it's like a continuous fluid or something like that that matters for the patient, then we need to think about maybe we should get a second line set up or something like that. So super important to understand that.
And we do have problems in this book as well, where a patient has multiple lines, like through their first IV line, they're getting XYZ. And then through a central line, they're also getting this amount of fluids. How much total fluids are they getting? So I went through example 3 in this section, but there's several other examples that have some variations. So you can get used to calculating how much fluid the patient is getting in a variety of scenarios. So, all right, everybody's good with that. Everybody saw how I got 2,600 milliliters and how we figured out how long lactated ringers is running in a 24-hour period? Everybody give me a thumbs up. All right, I'm gonna go ahead and erase this, and we are going to do a reconstitution problem now.
Oh boy.
I know everybody loves reconstitution, but I'll tell you what, and people freak out about reconstitution, but I'm here to tell you it's not as hard as you think it is, because they try to trick you on these problems, really. It's 100% they're trying to trick you.
It is way simpler than you think. Yeah.
You have to, and this is just some advice I actually offer in the intro video on the online companion. When you are doing a dose calculation problem, it's really important to only consider the numbers and the information you need to know to solve the problem, because a lot of times they will throw all sorts of numbers at you, and a lot of them are irrelevant. You don't need them for the problem at hand. So really, when you read a problem and you see like 5,000 numbers being thrown at you, try not to freak out and just be like, okay, what's the question and what's the information I actually need to know to solve the question? Okay, so with this reconstitution problem, we have an order. And can people see my writing? I hope so. Azithromycin, 80 milligrams, PO daily. So that is the order. And what we have available is a bottle for reconstitution. And the reconstitution instructions say to tap the bottle to loosen the powder. We need to add 9 milliliters of water to achieve, a concentration of 100 milligrams in 5 milliliters. of fluid. And after mixing, the bottle will contain 15 milliliters. Okay, so just to review, our order is for azithromycin, 80 milligrams PO daily. Our instructions are to add 9 milliliters of water to a bottle with a powder in it. We're going to mix it, and that's going to give us a concentration of 100 milligrams in 5 mLs. After mixing, the bottle will contain a total of 15 mLs. And we have 2 questions that are being asked. Our first is, how many milliliters should be administered per dose? And we need to round to the nearest tenth. And rounding, just as a little side note here, rounding is super important. You could get the problem right, like do all the calculations, and if you round incorrectly, you're going to get it wrong and you're going to be super duper sad. So in the beginning of this workbook,
I'm not speaking from experience or anything, but the only questions that I ever missed on dose calc in school were because I didn't round appropriately, because I didn't read the rounding instructions right. So in the very beginning of this book, we give you a whole list of dose calc tips for success, including stuff about how to round, what are trailing zeros versus leading zeros, like all kinds of stuff, because that's what's going to get you.
All right. So how many milliliters do we give per dose? And again, we're going to round to the nearest tenth. And then our second question is, how many full doses are in the bottle? How many full
and if
doses?
You're looking at this and you're saying, Kathy, it says to add 9 mLs of water. How do I end up with 15 mLs in the bottle? Because this is a thing that also stumps a lot of students. Remember that that powder is getting dissolved in the liquid and it adds volume. Because remember, if we add a solid to a liquid, it is going to raise the volume of that liquid. So there's enough powder in there that when you add 9 mLs, you will end up with 15 mLs total in the bottle. So don't let that freak you out. Don't be saying, well, where do they get those other 6 mLs? Don't worry about it.
Right. No, totally good point. Totally good point. All right. I'm going to solve part A, which is how many milliliters do we give per dose with dimensional analysis first. The reason why I like dimensional analysis, it's probably the most efficient way to solve the problem. However, when you're using dimensional analysis, you have to make sure you're putting the appropriate units on the top, on the numerator, and the appropriate units of measure on the bottom, the denominator. It matters where you put your numbers. With ratio and proportion, there's a little more flexibility. Okay, so I put here DA for dimensional analysis. And again, I'm going to address part A of this problem first. So we have an order for azithromycin, 80 milligrams, and we need to know how many milliliters we need to give per dose. And I'll tell you here this right now, in order to figure this out, all we need to know is the final concentration after mixing. The fact that we added 9 milliliters to this bottle is irrelevant.
It does not matter. It doesn't matter. They could say you added 1 million milliliters. The final concentration is 100 milligrams in 5 mLs.
And that is the only thing that matters. Now, occasionally you might get a problem where they ask you, how many milliliters do you add to the bottle to reconstitute it? And if you do get asked that, then the answer is 9 milliliters. That's what you add to the bottle. But if you're not asked that question, then don't answer that question, right? You just want to answer what is being asked and only use the numbers you need. So in order to figure out the milliliters per dose, the only thing I care about is that final concentration. So with dimensional analysis, I'm going to first write down the ordered dose, which is 80 milligrams. Okay, that's usually where I like to start when I do set up my dimensional analysis equation, is with what's ordered. And then I'm going to multiply this times the available concentration. And I'm going to be careful about how I place my units. So on the top, I'm going to put 5 milliliters. And on the bottom, I'm going to put 100 milligrams. And I set it up this way so that my milligrams will cross off and I'll be left with milliliters, which is what I'm being asked to find out in part A of this problem. So if I cross off my milligrams and do this math, I end up with 4 milliliters. That's the amount I'm going to give the patient per dose. And that's dimensional analysis. And that's how you would set it up and how you would solve it. Let's solve this same part A, with ratio and proportion, because some people may like that out there better. So I'm going to put, well, let's see. Do I need to erase some stuff here? I might
maybe
need
just
to
erase the DA stuff. Like,
yeah, okay, I'll do that. I'm like, I might be running out of screen room here. Okay. All right. So for ratio and proportion, we're comparing a known ratio to another ratio with an unknown component. So our known ratio with ratio and proportion is our available concentration. So 100 milligrams is contained in 5 ml. And on the other side of the equation, so I put my little equals there, I put my ordered dose, which is 80 milligrams. And I don't know how many milliliters it takes to give that 80 milligrams. So I'm going to put an X. So X is my unknown. Now, I could have set up this equation differently. I could have put the milliliters on top and the milligrams on bottom. As long as it's consistent on either side of the equation, that's what's important with ratio and proportion. So this is my known ratio, which is our available concentration, and this is our ordered dose, and this is our unknown. Now I am going to cross multiply here. So 100 times X, so 100X equals 5 times 80. So that's 100X equals 400. X equals 400 divided by 100. I end up with 4. So 4 milliliters. We got the same answer as we did with dimensional analysis. You can see it took a few more steps for sure. But if you are a fan of algebra or like doing the whole cross multiplication and you want some flexibility on how you set up the ratio, this may be a good method for you. All right, you guys ready for the last method?
Kathy and I duke it out all the time about ratio and proportion and dimensional analysis. So I am so here.
So you guys have to tell us in the chat which one you prefer. Well, maybe you see the third one. Now, again, the formula method works well for this problem as well. But the formula method does not work for every type of dose calculation problem. But for more simple problems like this, you can definitely use it. So with the formula method, we have desired over have times the vehicle. So that's desired over have times the vehicle. So for this problem, our desired is what's ordered. So that's 80 milligrams. What we have is 100 milligrams in 5 mLs of solution. That 5 mLs is our vehicle for getting that 100 and that 100 milligrams. So desired over have times the vehicle. And you'll see that our milligrams will cross off. And if we do this math, we end up with 4 ml as well. So that is the third way to solve part A of this problem. So I'm definitely curious what you guys like. Did you like the dimensional analysis, the ratio and proportion, or the formula? You'll have to see. Marisol, tell me here. Okay. So our answer to A is 4 milliliters. Again, we want to check our rounding because we never ever want to miss a problem because of rounding. It says to round to the nearest tenth. We're already rounded. This is a whole number. If we had a bunch of decimals, we'd have to worry about rounding to the nearest tenth, but it is already rounded to the nearest tenth as is. So 4 milliliters is our answer here. Okay, let's look at part B of this problem. So how many full doses are in the bottle? So according to our instructions, after we're done mixing, our bottle will contain 15 milliliters, okay? So our bottle contains 15 milliliters, and for each dose, we need to give the patient, we need to give them 4 milliliters, which is what we just calculated in part A. So if I take 15 milliliters divided by 4 milliliters, that will give me how many doses are in the bottle. So if I do this math, make sure I get my math right, 3.75 is what I get. Now, 3.75 is the answer to 15 divided by 4. However, can I give 3.75 doses to the patient? Is 0.75 of a dose adequate? The answer is no.
Especially because the question asks you about full doses.
Full
if
doses.
It said how many doses are in the bottle, you could get away with saying, well, there's 3.75 doses, but it says full doses.
Correct. So we only get 3 full doses out of this bottle. So 3 full doses is the answer to part B of this reconstitution problem. Does that make sense to everybody? As far as taking the total volume, dividing it by the volume per dose to get the number of doses in the bottle. I hope it does. Let me see.
Just want you to know that there are a lot of dimensional analysis supporters. I guess I will just go down with this ship and I will be the captain of the ratio and proportion ship as we sink because nobody likes it but me.
Okay. All right. What time is it? Do we have a time to go through a third thing or not really?
I think we do.
How many
5:37.
How many people? All right, we're doing pretty good. We're doing pretty good.
Oh,
you guys want to see a 30 sample?
Great comment from Future Nurse Ari. Is that similar to drops, GTT, when you can't have half a drop? Exactly right. I can't say, even if it comes out as 67.6 drops per minute, I can't give you 0.6 drops, right? So I have to give you 68 drops. Great comment.
Right. So if you are finding it helpful for me to kind of work through these problems and kind of explain how I'm setting it up and how I'm multiplying, that's pretty much what I'm doing on the online companion for every single example problem in this book.
You can pause her, you can rewind her.
Totally.
And we didn't even say this. In the online companion, she works it out every single way, but we have the chapters bookmarked on the videos so that if you're like, I am team formula, you can just click to watch her work it out in formula. You don't have to like scroll through and find where she does that because I don't want to do that. I know you don't have the time for that either. So that's another really great thing about the online companion that comes with the purchase of the book.
Totally. All right. Does anyone out there want to? So the number 3 voted thing that people wanted to see were safe dosage ranges in peds. That sometimes trips people up, and I can go over it now if you guys want to see that. Everybody want to see that?
All right. I want to see it, Kathy.
I think my headphones are starting to die though. Hang on a second.
Oh, no.
Which is super unfortunate because when that happens,
I'll mute myself.
Okay. Well, hopefully it'll hold out a little bit longer. Okay. In this safe dosage range problem, we have an order for amoxicillin, 150 milligrams. I'm going to erase this live 35. Write it down if you want to get this discount, guys. But it's kind of taking up some of my whiteboard room, so it's got to go right now. 150 milligrams PO every 8 hours. Okay, so that is our order. And what we have available is amoxicillin 125 milligrams in 5 ml. That is the concentration. Now, in order to figure out the safe dosage range, we're going to need to consult a drug guide, a drug reference guide, and that will tell us what the minimum concentration is for the drug to be effective and what the maximum concentration should be in order to avoid toxicity. And we need to make sure our dose is in between that minimum and that maximum dose. So per the drug guide, so our drug guide that we're using says that the safe range is between 20 and 40 milligrams per kilogram per day. And then our child weighs 33 pounds. Okay? And our questions we want to answer are, first of all, what is the child's weight in kilograms? This is a conversion factor that you absolutely have to have memorized, okay? So in order to figure out the kilograms, so this is part A, we're looking for the child's weight in kilograms. We're going to take their weight in pounds and we're going to multiply it by the conversion factor, which is 1 kilogram equals 2.2 pounds. You could just easily take 33 pounds and divide by 2.2, and that will give you the answer as well. But I just wanted to show you it like kind of spelled out here. This conversion factor here, 1 kilogram equals 2.2 pounds, definitely memorized. It's definitely on the inside cover of the book too, because you definitely need to know that. So if you do this math, you end up with 15 kilograms. So that is our child's weight in kilograms. So that is part A. Part B asks us, what is the minimum and maximum milligrams per dose that should be prescribed based on the drug guide? Okay, so according to our drug guide, the minimum amount that should be prescribed is 20 milligrams per kilogram for the day, and the max is 40. So let's first calculate the minimum. So per the drug guide, I should give 20 milligrams per kilogram over the course of a day. So if I take this, multiply times the patient's weight in kilograms, my kilograms will cross off and I am left with 300, right? 300 milligrams. Now again, this is for the entire day. And we want to figure out what is the minimum per dose. So we're taking this daily dose and we're dividing it by 3 because we're giving it every 8 hours. So there's 24 hours in a day, and if we give it every 8 hours, it means we're giving it 3 times. So we're going to take this daily dose of 300 milligrams, divide it by 3, and that means we need to give a minimum of 100 milligrams per dose. So this is the minimum. Now let's calculate the maximum dose that we should give. So maximum. The maximum is 40 milligrams per kilogram. And if we take this and multiply by the patient's weight again, which is 15 kilograms, then we end up with 600 milligrams per day. Again, this is 40 milligrams per kilogram per day. And again, we're going to take that daily dose, divide by 3, because we're giving it every 8 hours, and we end up with a maximum of 200 milligrams that we should give per dose. So the minimum is 100, the maximum is 200. And those are the answers to part B of this problem. Part C is asking us, is the ordered dose safe? Is it within that safe range? And if you recall, up here, our ordered dose is 150 milligrams every 8 hours. So is 150 milligrams in between 100 milligrams and 200 milligrams? And the answer is yes. It's right, dab in the middle. So it's not too high, it's not too low, it is safe. So now if our provider had ordered 250 milligrams every 8 hours. Would that have been safe? No, that would have been over the maximum dose that we should be giving every 8 hours. So that's an example of how you would go about calculating the safe dose range for a medication and then checking to see if the provider's order is within that safe range. Does that make sense to you guys? Did I lose everybody? or did that, like, was that helpful? That is something you're definitely.
This is a great question. Is it therapeutic if it falls below the minimum safe range?
It would be less than therapeutic, really. It would be less than ideal. It would be safe, but it may not be effective.
That's exactly right. Yeah. So it would be safe. It just wouldn't be therapeutic. Can you explain a clinical scenario with this medication used in real life? In clinicals, I've not seen any nurses do any calculations. Okay, listen. Let me tell you.
Has got you.
I have a story for you. And I was telling Kathy this story like 2 days ago or yesterday. I can't even remember. But I was telling Kathy this story because I think this is something that we hear a lot. Why do I have to do dose calc in nursing school? You never do that in real practice, et cetera, et cetera. Well, first of all, you might do it in real practice because unless you work in a setting that has a fancy EHR that will do all the math for you and whatever, if you're working like in a clinic, which is what I used to do, when we would have to give a medication for like some in-office procedures, we would have to calculate the amount to withdraw based on the patient's weight ourselves. We didn't have a fancy EHR with a MAR and all of that kind of stuff that would do it. It was a clinic, not a hospital. So depending on where you work, you may have to do it. But also, I told Kathy this, anytime that I am giving a medication that is like, not like just a atorvastatin pill or something where it's like 40 milligrams, cool, you know, whatever. If I'm giving something that is hemodynamically impacting my patient, like diltiazem, for instance, that's one that I think of all the time. Diltiazem can drop their pressure. They're on a drip for it. It's not a high alert med. It's not a med that I need a second RN to co-sign, but it is, in my opinion, a risky drug. Or if I am giving any kind of a high alert med, an insulin drip, a heparin drip, anything like that, which those things can kill your patient so quickly. Before I even see what the MAR says, I do the calculation first. I work it out myself so that that's a third check, right? I'm the first check, the second RN is the second check, and there's one more check for me, is do the math yourself and figure it out. The other day at work, I had a nurse say to me, hey, will you co-sign my heparin drip with me? And I said, sure, absolutely. And I go in and I look at the order and it says 12 units per kilogram per hour. And I say, okay. And I go over to the pump and it's set to deliver something like 200 some odd mLs in an hour. And if you don't work with heparin, you may not know that's a lot of mLs. Like that's a lot of mLs. Like that to me, checking for plausibility right away, saying that seems like too much. So I said to him, what does the MAR say? And the MAR said that he was supposed to get 9.73 mLs in an hour. And I said, I don't know what you've done, but this is not correct. And I had to clear the pump and everything like that. And I did the math on paper to show that RN, like, here's how the MAR is getting this correct answer. This is what you should be getting. And it's super duper important that you be able to do that math. I'm not saying that in a given shift that I show up and I'm just like banging out dose calc problems all day long. No. It's not like that. But you should be able to do it because computers are they are perfect machines that are programmed by imperfect human beings. And so
100%.
It is very possible for there to be mistakes made. And with your license on the line, you want to protect it, because if I had co-signed that and that man bled to death in our ER because he was getting 200 mLs when he should have gotten 9, I am also at risk here. My license would have been on the line too. So super duper duper important to check that.
Yeah, and you just need to really understand the reasonableness of a dose too. Like if you see some inappropriate dose, or the math isn't working out, you need to really raise the red flag. And speaking of heparin titration, I mean, we have a whole heparin titration section in chapter 11 of this book, which is the last chapter. This is something I totally could have used before I started my job on a med surg floor. So we did not, in my nursing program, we did not go over heparin titration or heparin protocols. And I knew that you had to dose heparin based on the patient's APTT level, but I wasn't familiar with using a protocol for the dosing regimen. And that's something I absolutely had to do on a med surg tele floor as a new grad. And so I had to be trained up on that. So we have included a dosing protocol for heparin titration and several example problems for you to work through so you can be comfortable with that before you start your job and have to do that type of thing.
Yeah,
all right,
absolutely. I also just put a comment in to let you guys know what this book covers. There's lots of questions like, do you cover peds? Are you covering maternity? Absolutely. I put the comment in here, but I just want to read you the table of contents. The first chapter, we do units of measure and conversions. That's that stuff you do like day one, maybe in chemistry, something along those lines. Chapter 2 is abbreviations, prescriptions, and drug label components. We literally show you what a prescription should look like, what it should have, what an order should have, all of that kind of good stuff. Chapter 3 is oral medications. 4 is injectable medications. 5 is insulin. We have a whole insulin chapter. 6 is concentration, reconstitution, and dilution, all 3 of those. Chapter 7 is intravenous therapy, so your things like drips and secondaries, piggybacks, all that good stuff. Chapter 8 is intake and output. Chapter 9 is pediatrics, where, you can see we cover a whole lot in peds here. Chapter 10 is maternity, and Chapter 11 is critical care and advanced practice. I don't actually know the answer to this question. Does the 1-year access to the companion, digital companion, start upon purchase date or when we log into it? I don't know.
That's a good question for our business team. I'm guessing when we're still. It's like, I think it's from. Okay, can you clarify? Does the 1 year? I believe when you log in. I believe that is when it starts. I'm
verifying right now.
You're verifying. Okay.
Yes.
While she is verifying, I want to give you guys another. Okay, so you have Live 35. That's the 35% off the dose calculation workbook. Valid today. Limited quantity. Ends at midnight. There's a second discount code I want to give you, which is Live Bundles, and that is 10% off of our ultimate bundles. And I'll explain what that is.
And I just dropped the link in the comments also. So if you're like, what are you talking about?
All right. So you guys are probably, hopefully you're familiar with our flashcards. So this is like our pharmacology flashcards. And I'm not sure if you're familiar or not with our Nurse Squad card games, which are amazing. So we have combined these things to create these ultimate bundles. So the flashcards are for you to learn and to learn through repetition and to get all of the key concepts and points you need to know to be successful in nursing school and on your exams. And the Level Up Nursing Nurse Squad card game will help to test your knowledge, to reinforce what you've learned through the flashcard set. So together, you're going to learn, you're going to confirm your knowledge and have fun at the same time. This is an amazingly fun game, and it will really help to not only test your knowledge, but just, if you're getting things wrong, you're going to be learning, but having fun at the same time. So this is the pharmacology ultimate bundle. We have ultimate bundles for med-surg, maternity, and peds as well.
Yes, and I cannot tell you how much we worked to try and make this super duper fun and informative, because I just felt like there was never anything I could do that was fun in nursing school. Like we would try, like my professors would try and do like Jeopardy or something like that, but on your own, there just wasn't much of a way to make it fun. And also, when I would go to study groups, which I stopped attending because they were never productive, we would always show up with good intentions and then we would get distracted and start talking and all of that. So this is a really great way to study with your friends and have fun, but stay on track and review.
Totally. So really the combination of those two things, if I had that in nursing school, like you are set, like you are getting the core information you need to know, and you have a way to review and test your knowledge and just be absolutely prepared for your exams within nursing school and for the NCLEX. It's really great.
Yes. So also there was a question about do we have any codes just for Nurse Squad? So we don't have any codes dedicated for Nurse Squad. However, if you buy all 4 of them, we have like you can buy all 4. It's the Fab 4 bundle, and it comes at a discount. So it saves you $20 off the individual subjects. So that one you don't need a code for. It's just available right there. Oh, this shout out is for Deanna. Thank you. That's amazing. I don't know if she's watching, but Deanna, you just got a shout out. Deanna is awesome.
Yeah, Deanna is awesome. She's the one who like our customer service, packs our bundles, packs all the orders. I think she's been with us for 3 years. She is amazing. Such a nice person. Amazing. Okay, remember these 2 codes are only valid through tonight, midnight Pacific Standard Time.
Which is
definitely
3 a.m. Eastern.
Yep, totally. And then the last thing we want to do at the end of this live is we want to actually give away a dose calculation workbook to one of the live attendees. So Maris, do you have who that is? Who our winner is going to be?
Yes, I do. Hang on one second. So it is going to be Sarah Elizabeth. Sarah Elizabeth is a YouTube member. So thank you so much for being a member. That is amazing. But you will be getting a dose calc workbook headed your way. And I feel like if maybe you wanted Kathy to like sign it or something, like I feel like maybe she would do that.
I would totally do that, but I don't have to do that. So if you're like, no, I don't want that, then I will not do that. But if you would like a little note, if they're shrink wrap, so I can just send you a little card with it if you like, Sarah. Tell us in the chat whether you want that or not. Or you can say, no, thank you. I am super not insulted at all. If you do not, you're like, girl, just send me the book. Do not send me a note. So like, okay. Anybody else have any other questions?
I really hope you guys love this. We worked so hard to make this the book that we wish we had, because we all had different resources that we used, but none of them were exactly what we wanted. And so we did our best to make this and to support you with the online dose companion, which comes with the purchase of this workbook. So you don't have to worry. It's a combo deal. You can't go wrong. You're going to get both of them. And I really hope you like it. Please, if you get it, we want to see pictures of you using it. We want to hear your feedback. If there's something that you think like, hey, it would be great if you did this too, we want to know. So hit us with all of that feedback. Let us know what you love about it. It will make our day. I guarantee it. And it will reach us directly. We read all of your feedback.
Totally. All right. I can't wait to get it. I've been waiting on this book with the videos. Just seeing if there's any other questions.
Oh,
here.
yes. Sorry, I did receive a response about the 1 year. But Kathy was talking. I didn't want to interrupt her.
Sorry.
Yes, so it is 1 year from date of purchase. I was able to confirm.
All right. So glad you were able to figure that out. Any other questions for us about the book or just in general? Any materials for critical care nursing other than dosage calc? Yeah, so our MedSurge flashcard deck has critical care topics in that as well, because there's like really a huge amount of overlap between MedSurge and critical care. So a lot of the disorders that you learn about in MedSurge, those patients become critical care patients when those things aren't addressed, and can lead to complications, which can land you in ICU. So really the MedSurge deck was intended to kind of go from an A&P overview, so an overview of anatomy and physiology, all the way through like MedSurge and pathophysiology, and then also touch on critical care subjects as well.
Yes, and I would also encourage you, if you are in critical care, that you should check out our lab values deck along with ABG and, obviously pharm, because there's pharm stuff in critical care, but EKG as well. So whenever somebody asks me about critical care, I always say MedSurge, lab values, ABG, and EKG. That's going to be the stuff that kind of everything, that you need to know for critical care stuff is going to be somewhere in those decks.
Totally. Is it good to use this book to prepare for nursing school beforehand? Absolutely. If you can get just give yourself a nice review, at least the beginning part of the book on converting within metric, converting between metric and household units, converting between standard and military time and Fahrenheit and Celsius. If you can kind of have those things down, you're going to give yourself a really nice foundation when you're, start nursing school. There's so much to learn right out of the gate in nursing school. So if you've got this dose calculation book and if you have some of those basic calculations down, your future self will thank you greatly.
Yes. And Johanna asks, can I ask a weird question? Is the book like a good dosage calc for dummies? Like it goes from the basics to the complex? 100%. And we separated it into chapters so that you can find whatever it is you're working on. Because when you're in school, I'm not worried about maternity when I'm in fundamentals, right? I don't need to know about how to calculate oxytocin drips when I'm in funds, and vice versa. I'm not thinking about intake and output when I'm in maternity usually. I mean, like there's some other stuff I need to be worried about. So we have it that way just so that you can get what you need from it. Also, Sarah says she absolutely wants the autograph. She wants me to send one too. I will send you a card separately because Kathy and I are in different states.
We are in different places.
I will make sure to get your address from Angelina, and I'll send you a card too. Is this book good for the MedSurg ATI? So here's the thing. Every single ATI exam you take, every single exam in nursing school, in theory, and the NCLEX can and will have dosage calculation on it. In my program, it was a guarantee that beginning in funds, you would have at least one dosage cal question on every exam, even if it had nothing to do with anything. And we sure did. And I got them on ATI all the time, and they are on NCLEX. So the answer is it going to help you answer like MedSurg content? Like, no, that's what you want our MedSurg cards for, MedSurg videos, all of that. But is it going to help you with the MedSurg dose calc that is more than likely going to be on that exam? Absolutely.
100%. Totally. And you always want to get those questions right. Like those are, if you can learn dose calculation and be comfortable with it, then you will always get those questions right. Those will be easy points for you. And then you can save your points for like some random drug that they're going to throw your way or some crazy question. You never want to give points away on dose calculation. So definitely get comfortable with it. We want to help you get comfortable with it and feel confident so you can get those points on those exams with no problem at all.
Yes. And lastly, somebody just asked, where can I get this? And I'm going to drop the link right here in the, I just screwed that up. I'm going to drop the link right here in the comments in 1 second. It is live on our website right now, but there's the link to it as well in case you need to find it directly. Remember, you can use Live 35 right now until we run out of coupon codes or it expires at midnight. And you can also, if you want to check out the bundles, the ultimate bundles of flashcards and our Nurse Squad card games, you can use the Live Bundles code right there as well.
And it seems like some of the people watching today are like getting ready to start nursing school. So I did want to mention that for many programs, for my program, we did have to pass dose calculation tests every semester at the beginning of the semester. And I had to pass with 100%. And if we didn't pass with 100%, you did not get to continue on that semester. You basically failed that semester. And I know there's lots of other schools that do require 100%. Some may require slightly less than that, but almost every nursing program I know requires dose calculation tests at the beginning of every semester. And they lose students every semester who don't learn and really master that material. And we do not want that to be you. We want you to feel 100% confident. And we feel like this book is really going to help prepare you so that you can feel confident and pass those exams, with flying colors.
For sure. Just make sure, there was a comment about this earlier, or question about it, every school has different policies and procedures, just like every facility does. So always make sure to clarify with your institution. At mine, we had 3 attempts. So you earned the score of whatever your first attempt was. But if you didn't reach that benchmark, you got a second attempt. And if you didn't reach it again, you got a third attempt. And if you didn't, then you had to drop the course, and that would set back your graduation. So it really is super duper important. And just make sure that you understand what your school requires, because you don't want to kind of blow it off and then end up being like, oh my God, I fail. We don't want that for you.
Totally. Yeah, I think we got 2 attempts, but it was 100%. Like it was full, and people failed. Like I know people who did not get it.
I only ever had to repeat the test one time, but it was 100% because I did not read the rounding instructions. I know how to round. I didn't read what it asked me to do. So it would say round to the nearest whole, and I would round to the 10th, and then that is wrong. You're wrong. Even though
you'll get it wrong.
Right, you are wrong. So make sure you really, really pay attention to that stuff, because those little things will get you.
Totally. Read the question slowly and carefully. Don't rush through it. Double check your work before you hit that enter button with your answer. Okay.
Oh, yes, please.
All right. We're going to head out now. We are so grateful and happy that you were able to join us for this exciting day. I hope you love the book. Thank you for joining us.
To see what you think of it. Like I said, please tag us on social, send us an email, support@LevelUpRN, review it. You get that email asking you for your review. We want to know what you think about it. And for sure, if there's stuff that you're like, man, this is so cool, but also I wish you could, we want to know that too. Hit us with all of your feedback, show pictures, take it to school, share it with your professors. We're just so excited to get these in your hands. And I really genuinely hope you know how much Kathy and I and the entire Level Up RN team are always in your corner, always have your back, and always want what is best for you. So we're rooting 100%. For you.
Yeah, awesome. Have a great rest of the week and the rest of your summer, and we'll see you soon.
Bye, friends.
Bye.